Hello, you care warriors. This is Sophia, mom, wife, caregiver, and geriatric social worker. If you have ever taken your parent to the doctor's office, to a hospital, or to the emergency room, then I'm sure that someone along the way has asked if your parent had an Advance Health Care Directive. And you thought, man, we need to get that done, but I'm not quite totally sure what it is, how to fill it out. Well, you will after you watch this. I've made this video series so you'll have all the information needed to help your parent complete an Advance Health Care Directive. In videos 2, 3, and 4, I'm going to provide honest information on the 3 most important decisions that are commonly included on Advanced Health Care Directives: CPR, mechanical ventilation, and artificial nutrition and hydration. And in video 5 in this series, I'll share with you how you can go about having these really tough conversations with your parent to find out what they would want for themselves under different medical circumstances. But first, let's get started with Part 1, Advanced Healthcare Directives. There's a lot of confusion out there about Advanced Healthcare Directives, and there's a lot of confusing terminology, so let me start with some basic definitions. The first term you might have heard is Advanced Care Planning. Well, and that is not just one decision, but it is a process in which you learn about some of the different medical decisions that might come up at some point in the future, and to really consider them for yourselves under different circumstances and deciding what you would want based on your own unique values and point of view, and then to let others know what your wishes would be. The second term is Advance Directive. An Advance Directive is just a legal way to inform others about your wishes ahead of time. Those wishes that you decide on during your Advanced Care Planning process earlier. Advance Directives can come in different forms. Some common Advance Directives include a living will, a pre-hospital DNR, or a POST, which is a physician's order for life-sustaining treatment, or in some places they call it a MOST, medical orders for life-sustaining treatment. Some of you might even have a little sticker on your driver's license that designates you as an organ donor. Well, that is a form of an Advance Directive. Now, an Advance Healthcare Directive form is the most widely used type of Advance Directive. It's legally recognized in every state. It's super comprehensive and super easy to execute. And this is what I'm going to talk about today. Having any one of these Advance Directives in place will increase the likelihood that your wishes will be carried out even when you can no longer speak to the doctor about what you want for yourself. So what is an Advance Healthcare Directive? Well, it is a legal form that allows you to do 2 things. First, it establishes a POA, or Power of Attorney for Healthcare. It means you designate who you want to speak on your behalf regarding medical decisions in case a day comes that you can't speak for yourself. The person you choose is also known as your agent, your representative, or a surrogate decision maker, also a healthcare proxy. The second thing that you can do on an Advanced Healthcare Directive form is to state your wishes about treatments or medical interventions that you might want or not want under certain circumstances. This part is called a living will. You can choose to only designate a power of attorney or only to indicate your wishes, or ideally both. The form is super easy to legally execute. It does not require you to hire an attorney, and you can do this all by yourself. In fact, I've seen an Advanced Healthcare Directive drafted by an attorney, and it said, no heroics, no life support. But it also said, use of mechanical ventilator is okay. What is that supposed to mean? The use of a mechanical ventilator is about as major a heroic life support measure that you could get. So don't always assume that an attorney can identify when what you ask them to write makes no sense at all. It just needs to be signed by the person creating the form. In our case, we're talking about your parent, or they're also called the principal. The form cannot be signed by you or anyone else on behalf of your parent. Only your parent can sign the form. If your parent lacks the mental capacity to fill out the form and sign it, well then unfortunately it's too late, and that's why it's super important that it's completed while your parent is mentally sound. Depending on which state you live in, the signature needs to be either witnessed by an appropriate witnesses or notarized. Each form will tell you what's required. For example, here in California, the form just needs to be witnessed by 2 people, and these witnesses cannot be named on the form as the agent or an alternate agent, and one of the witnesses must also sign that to the best of their knowledge, they are not related to your parent by blood or marriage and are not in your parent's will. If you cannot find an appropriate witness, then you can choose to have the form notarized. And if your parent is a resident of a long-term care facility, like a nursing home, then it usually needs to be witnessed by the long-term care ombudsman. You can ask the social worker at the facility to assist with this. Now, a couple of points about what an Advance Health Care Directive is not. It is not the same as a power of attorney for finances or a general power of attorney. A power of attorney for finances allows you to assign an agent authority over all your finances and assets, and it has nothing to do with healthcare decisions. Ideally, a person would have both an Advance Health Care Directive and a general power of attorney for finances if they want to make sure that most all of their affairs will be taken care of. An Advance Health Care Directive is not the same as a conservatorship or a guardianship. These are court processes in which a judge decides who will have the authority and decision-making responsibilities over a person's health care decisions or their financial affairs. Conservatorship and guardianship are for cases where a person no longer has capacity to manage their own decisions and does not have the mental ability to sign a legal document such as an Advance Health Care Directive. So, who really needs an Advance Health Care Directive? Well, we usually think about the older adults who need one or someone with a serious illness, but actually everyone needs one. Like an insurance policy that you'll hopefully never use, but you get it just in case, an Advance Health Care Directive is one of those things that everyone should get in place before they're needed, just in case. Unfortunately, I've seen too many young adults in their 20s who have been in car accidents or are victims of violent crime, or patients who are in their 30s, 40s, and 50s who had a sudden heart attack or other health crisis, and they had no Advance Health Care Directive, like most people. And the family just doesn't know what that person would have wanted because they never talked about what treatment interventions they would want. So if you're thinking about helping out your parent or someone in your family completing an Advance Health Care Directive, well, please print out an extra copy for yourself as well while you're at it and complete it for yourself just in case. Now, who can complete an Advance Health Care Directive? Well, you must be 18 or over, and you must have the mental capacity to understand and sign a legal document. That's it. Once it's signed and witnessed or notarized as appropriate, then make a lot of copies, give copies to your doctor, to all the agents, bring a copy every single time you go to the hospital or to the emergency room. Don't put it in your safety deposit box where no one can get to it because it does absolutely no good there. Well, what happens if you don't have an Advance Health Care Directive and you lose your capacity to make your own healthcare decisions? Then, in that case, the nearest family member, according to the law, will be the designated decision maker. It might not be who you want to make decisions for you. Your family might not know what your wishes are or what you would choose for yourself. They may feel guilty about even considering not agreeing to medical interventions, so they agree to do everything, meaning you could stay on life support for years, seriously. Or if you have 2 equal decision makers, like 2 adult children, who don't agree on what to do, then the medical team will likely err on the safe side and do everything just to keep from being sued. And that might not be what you would want for yourself. One time when I worked in the ICU, there was a very, very sick woman, and she needed critical decisions made regarding life support, and she had no Advance Health Care Directive, and she had never spoke to her family about what she would want for herself. And her adult children couldn't agree on what to do, and they actually got in a major fist fight right there in the ICU waiting room. I'm sure that your parent or you wouldn't want to put a huge stressful burden like that on your family members over such an important decision. Some people say, well, I'll let my family decide what to do with me. Well, that's just way too much pressure, especially if you've never told them what you want. take that burden off your family. Their role should be to be your spokesperson and tell the healthcare team what you would want if you could sit up and say it yourself, and to say it with absolute certainty. This is your life, and how you live it is your decision. And how you die should also be your decision. Having an Advance Health Care Directive is going to help ensure that your wishes are known and taken seriously by family and the medical staff, because it's the law. Caringinfo.org has made it super easy to find the approved Advance Health Care Directive form for every state. I'm going to put a link below so you can print out the form specific to where you live, along with instructions. But don't just print it out and sign it before you watch the rest of this 5-part series. You're going to want to watch the next 3 videos for decision-making assistance regarding CPR, mechanical ventilation, and artificial nutrition and hydration. And in the last video, I'm going to talk about the best ways to have these really hard conversations with your parents. And if you have any questions about Advanced Healthcare Directives, or would like to leave me a comment or a message, I'd love to hear from you, so leave me a comment below. If you found this information even a little bit helpful, then please hit the like button, share this video with your family and your co-caregivers, and if you don't want to miss any of the next videos in this series, then please hit the subscribe button below. That's all for now. I'll see you next time. Ciao.